for instance, or in 2010 if you like, because it's not changing dramatically year by year, is in the area of $6 to $7 billion. And the gap that we estimate this year is in the area of $1 billion. I'm looking at Catherine Floyd, who's our health economist, besides the chief of the team that produced this report. So in case there are more details, you can always intervene. So we are talking about $1 billion at least of gap, and about $3 billion gap foreseen for 2015, because this plan goes until 2015. So the gap will increase, because the total amount of money necessary for TB control will increase if we have to implement, more and more, let's say, new tools, for instance, new diagnostics, or more and more treatment for MDR-TB. Of this 6-7 billion, whatever we want to use as a figure, which is always an estimate, remember, 80 to 85% is actually coming today from domestic sources, with big variations in countries. So there are countries that can fund their own program completely. There are countries, especially in Africa, that perhaps put only 50 or less than 50% of their resources into their total budget. So that varies, and that's where then the international mechanisms come in, because we have this gap in countries already foreseen and being present today that has to be filled somehow, and that's where the Global Fund comes in and so on. The strategies, therefore, have to be obviously dual. Number one is the domestic issue, and that is where then there should be this additionality mechanism, put in place and actually implemented, requesting countries that benefit from multilateral or bilateral money also to invest their own money, because this has to be done, otherwise these various interventions are not sustainable.